Greetings everyone. Thank you for taking your time to see our presentation. I'm Vasant from University of Minnesota Twin Cities. Here I'm presenting on the topic optimizing multi-scale entropy method for rotor core identification using simulated electrograms. I will give a brief background details before we dive into the exact details of this work. First, let's see what is an arrhythmia. Any irregular heart rhythm or electrical activity in the heart is called arrhythmia. When there is a chaotic activity in the atria, it is called atrial fibrillation, which is mainly characterized by rapid and irregular atrial beats. AF by itself is not a fatal heart disease, but it is considered to be a precursor to other fatal heart diseases. Atrial fibrillation can be broadly divided into two groups: paroxysmal AF and persistent AF. Paroxysmal AF is a condition where the chaotic atrial rhythms are present intermittently. They are also capable of terminating spontaneously, which means medical intervention is not always required in paroxysmal AF to restore normal rhythm. Persistent AF is a condition where the chaotic atrial rhythm is always present in the patient. Medical intervention is required to terminate AF or to restore normal rhythm in persistent AF patients. Atrial fibrillation can be treated using pharmacological procedures where drugs are administered to control and restore normal rhythm. There are some side effects that can be caused due to the drugs and the rising costs, which are a few drawbacks of the pharmacological treatment. Another alternative to the pharmacological approach is the catheter ablation therapy. In catheter ablation therapy, a scar or a lesion is introduced in regions of atria that contain the origin of abnormal electrical activity. Identification of these active sites is still not very optimal. Therefore, the success rates of the ablation therapy in persistent AF patients still range only from 40 to 60%. One of the electrical mechanisms that characterizes AF rhythm is believed to be rotors. A rotor is a rotational electrical activity present in the atrial tissue. An example of a rotor is shown to the right of your screen, where the voltage map is plotted over time. You can probably notice that the electrical activity is spinning around the central area. This center is called the core or the pivot point of the rotor. These cores are believed to be good target sites for ablation. Existing approaches such as local activation time maps, dominant frequency maps, phase maps fail to identify consistently the location or the sites of rotors. Therefore, multiscale entropy is a method that was developed to identify the core of the rotors using electrogram signals. Multiscale entropy determines the complexity of short-term time series signals. It is used in various biosignal processing applications. First, a moving average signal is obtained using the scale factor tau, using the equation shown to your left. Then, the template matches are obtained at mth and the m plus 1th dimension. Finally, a negative logarithm of the template matches is taken to obtain the MSE value. Now, let's move on to the objectives of the current work. In the current work, we aim to optimize the MSE approach to better identify the rotor cores. To do this, we initially targeted improving the sensitivity of rotor core identification by identifying the optimal scale factor tau opt. Further, we also studied the dependency of this optimal scale factor with respect to different sampling frequencies of the input signals. To inspect the objectives of our study, in this work we used a simulated dataset. A stationary rotor was simulated in a 25 x 25 mm human atrial tissue grid using cross-field stimulation. Unipolar electrograms were obtained for each pixel in the 100 x 100 pixel grid. Also, 4 different simulations, each of different sampling frequencies 500, 1000, 1500 and 2000 Hz were obtained for the same time length of 2 seconds. Next, to your left is the voltage map of a simulated stationary rotor. This is taken from the 1000 Hz simulations. To your right on the screen, you can see the true core of the rotor represented by the white area. The true core is identified using a widely accepted phase singularity approach. The phase singularity points obtained are considered the true core of the rotor. It should also be noted that the core of the rotor is located only in a very small spatial area. That is, the white area is very small. Next. Here are a few examples of unipolar electrogram signals at different sampling frequencies. These time series signals are the inputs to our MSE approach. Next, I want to show examples of two identified cores using the MSE approach at different scale factors. On your left, you can see the core obtained for tau is equal to 1, and to your right you can see the core obtained for a scale factor of 10. The core is enclosed in a white boundary identified using the thresholding approach. The core identified by the scale factor 10 is more closer to the true core that I had shown earlier. Further, to identify the optimal scale factor, we obtained the sensitivity of rotor cores identified at different scale factors from 1 to 12 as shown here. We observed that beyond a scale factor of 10, the sensitivity of the rotor core identification did not significantly increase. Therefore, at a sampling frequency of 1000 Hz, we identified the optimal core to be 10. Next, we wanted to see the dependency of the optimal tau value with respect to sampling frequencies of the input signals. Therefore, to identify the optimal tau value for different input sampling frequencies, similar convergence plots as shown before was made, and the optimal tau values identified are listed in the column 2. We can see that as sampling rates increase, the optimal tau value also increases. However, if we observe the optimal tau in terms of length of the template, it can be seen that the length of the templates remain approximately 20 milliseconds as shown in column 3. Therefore, the optimal tau value should be determined based on time and morphology of the signals rather than just the number of samples present in the signal or the sampling frequency of the signals. Finally, to summarize our results, optimized MSE approach provides better rotor core identification by improving sensitivity. Optimal scale factor is determined by the morphology of the signals. MSE remains effective at different sampling rates. Therefore, we can use the MSE approach to successfully identify rotors and the rotor cores. Once again, I would like to thank for taking your time to see our presentation. If you have any questions, please feel free to contact. The links are provided. You can pause the video to note my email or contact via a website. And I would also like to take the opportunity to thank all my lab mates and our funding sources which helped us with this work and our continued research. Thank you.